Okay, going all the way down now to the terminal end, and this is where the gas exchange takes place. Remember, I said we had these little grape-like structures? The entire grape-like structure itself would be an alveolar sac. And if we zoom in and take a look at a few of these little grape-like areas, we can see that there are pores in between them that help equalize the pressure. That's so one of them doesn't overinflate and pop, while the others aren't getting enough air. They've got these pores in between them to make sure that they all get a relatively equal amount of air. And the surface area of these is incredible. If you took these and you ironed them out for both lungs, they would cover an entire tennis court. So every time you take a breath, which is roughly 18 or 19 times a minute, every time you take a breath, you have the surface area exchange of an entire tennis court to bring in oxygen and to breathe out carbon dioxide. Now, if we zoom in and we look at just one of these little grape-like structures, it's called an alveolus. It's got this, I don't know, kind of like a beaker or something, the pitcher kind of a structure. And most of the cells that make up these are called type 1 pneumocytes or type 1 alveolar cells. It means the same thing. They are simple squamous, which means simple means it's one layer, squamous means it's flat. And that makes sense because this is where we want gas exchange to take place. So we want these cells to be as thin as possible to allow the most rapid diffusion possible for oxygen and carbon dioxide. Now, along with those at various intervals, we have the type 2 pneumocytes, or the type 2 alveolar cells. These are simple cuboidal, so they're raised up somewhat, and these are responsible for secreting surfactant. They also happen to be the target cell of the COVID-19 virus. But surfactant is absolutely required for life. Um, as a matter of fact, whether you understand this or not, the United States laws on abortion, Roe versus Wade, were written specifically to account for surfactant. And the reason being was during the time that that law was written, you could not survive if you could not produce surfactant. And this happens in the last trimester. So if you delivered prior to, say, month 7, there was zero chance of survival. And if you delivered premature, then it would basically come down to a matter of were these cells functional enough to have enough surfactant to keep you alive. There is a classic example of this from a United States presidency. In 1962, when John F. Kennedy was in the White House, his wife Jacqueline Kennedy became pregnant with what turned out to be a baby boy. And most people were not aware of the fact, but Jacqueline Kennedy smoked 2 packs of cigarettes a day. And when we talk about the reproductive system and we talk about pregnancy, you will learn that that causes additional stressors and frequently results in premature births. And as a matter of fact, Jacqueline Kennedy delivered 4 babies, and all 4 were premature. The first one died, and then Carolyn was born, and she survived. And then John F. Kennedy Jr. was born, and he survived. And the 4th child was a little boy named Patrick, which was delivered in the summer of 1962. And unfortunately, Patrick was not making enough surfactant. And what that meant was every time he breathed out, his lungs collapsed. So he had to then reinflate them just to breathe in. And this requires an extraordinary amount of energy to do this, over and over and over and over. So you can imagine this is the president of the United States' son. He's getting the best care possible. He was in the Children's Hospital in Boston, and they even had in a special hyperbaric chamber for him to assist him with the breathing. So the little baby Patrick is in one hospital, and Jacqueline, who had to have an emergency cesarean, is in an adjacent hospital, so she doesn't even get to visit the baby. She can't see the baby, and the baby struggles for a little over 24 hours and then dies without his mother ever being able to hold it or see it. And Jack at least got to hold the baby, and it had a um, tragic but also interesting effect in that the president and the first lady, who had pretty much led separate lives other than official functions up to that point. I mean, she was taking vacations to Greece and things like that, separate from him. And he certainly had his own picadillos. After that, this tragedy seemed to bring them closer together, so much so that she actually volunteered to campaign with him because um, in 63 they were going to be, especially late 63, campaigning for the 1964 presidential election. And Jacqueline was a tremendous political asset. Typically, if she showed up, the crowd size would double. And so Jack's political advisors were thrilled that she agreed to do this because she hated campaigning, but she wanted to stay with her husband. And so the very first campaign stop that they went on together as a couple was to Texas. And if you know anything about November of 1963, you know that trip didn't go too well. And she ended up coming back with her husband in a casket. Anyway, how does that all relate to Roe versus Wade? Well, the abortion laws basically say that if you want a abortion in the first 2 trimesters, you can do it for any reason that you want. In the last trimester, because at that point the fetus is considered to be viable, you have to have a specific medical reason for having the abortion. Now, in our society, it is not extraordinarily difficult to find a doctor that will supply that rationale for you, but the point is, legally, that is required. It is required because at the time, uh, it was impossible to live prior to the last trimester. And so the law was written based upon that precept. Now, if you are aware of the status of neonatal medicine today, we can keep babies alive a lot earlier than that. And if you're wondering why I'm using the term baby and fetus, the way the law is written is when a woman goes into labor, no matter what time that is, no matter how far along in the pregnancy, legally, it is a baby at that point. Prior to that, it is a fetus. So legally, if let's say you are going in for an elective abortion and you go into labor, legally they can't give you an abortion at that point. By law, it would be considered murder, which is interesting in and of itself. Our medicine has far outstripped our society's um, agreement on how we handle things. For example, let's say a couple has some embryos frozen, so the sperm and the egg successfully intermingle and create a zygote, and then you have an embryo, and they're going to freeze them because they are not wanting to have kids right then, but they know that the older they are, the greater the chance that there could be like some sort of problem, and maybe they're even thinking surrogate mother or whatever. But then let's say they get divorced. What is the status of the frozen embryos? Are they property? Are they people? Are they trash? What are they? Like I said, and I have no answers for this on either issue. If I did, I wouldn't say it because I don't think it's my job to try to politically influence anybody. Uh, but informing you of the law is certainly not a problem, nor the basis of it, which all goes back to show that now the surfactant thing is not an issue. We can keep a baby alive at about 4.5 months. So you can have a baby that's a little over a pound and maybe about the size of my fist, and we can keep them alive and, go on and they can have a normal life. Now, it will cost about $1 million And that's not an exaggeration. It will cost about $1 million of NICU time and effort, and there will be little tubes going in every orifice of this little baby's body. But the point is, it's possible, and it wasn't before. And that's because now we have artificial surfactant that we can spray in. Had we had that in 1962, there would still be another Kennedy son alive. His name would be Patrick, because we would have just blown in artificial surfactant, and he was plenty old enough that had we had that, he would probably survive. Anyway, hope the story helps make points about the type 1 and type 2 pneumocytes. So if we zoom in now, and we're going to look at I guess at this point it would be a frontal section. Here is the basement membrane, and on top of the basement membrane, we've got the type 1 and type 2 pneumocytes. You can see the type 2 pneumocytes are cuboidal, so they stand up a little bit over the type 1 pneumocytes, which are just squamous cells, which means they're flat. Also, although I didn't show it, we would have alveolar macrophages crawling around in here, cleaning up debris, just as part of the normal environment inside the alveoli. So here we would have blood coming in from the heart through the pulmonary artery. And of course, this is the only artery that carries deoxygenated blood, because it's coming from all the tissues of the body into the right side of the heart that pumps it to the blood. And as it goes around the surface here of the capillary, blood is added. And remember, hemoglobin changes color, so the blood color would actually become more red as it flowed past the capillary. And of course, you're exchanging carbon dioxide in the opposite direction. Also, just for a future lecture standpoint, I will point out that the endothelium, these cells here of the capillary, are also producing something called ACE, which stands for angiotensin converting enzyme. And this is an important step in a method that we have of controlling our blood volume and blood pressure. And if you're hypertensive, probably what the doctor is going to use as a first, let's say, more gentle step for as far as diuretics are concerned, is give you something called an ACE inhibitor. So if you know somebody on an ACE inhibitor, this is what we're inhibiting, is the enzyme that is being released by these cells that are going to contribute. It's a much less impactful diuretic than probably one that you've all heard of called Lasix. Lasix is a very powerful diuretic, and generally you don't want to make that your first step. Okay, well, there's a better look at the alveoli and some nice political history and legal information that I throw in because I hope it'll help you remember the significance of the structures that you're looking at.